and welcome to Cancer Watch, a public health program on cancer awareness brought to you by the Comod Cancer Foundation in partnership with Arcon and proudly sponsored by Plus TV Africa. My name is Dr. B. Olutunde Olusegun. I'm the Arcon representative, and in just a minute you'll find out the marvelous reason why I'm alone on this side today. Remember, today's episode could be the conversation that saves a life, maybe even yours. So please share, follow, subscribe on YouTube, Instagram, and Facebook. Let's get the message across and keep helping people get informed, and by so doing, save lives. Today's episode is titled Living with the Unknown, the day-to-day reality of brain cancer patients. Did you know that brain cancer could either start primarily in the brain or be a spread from other parts of the body? Women make up about 59% of patients with brain tumors, and it's interesting to also note that it's documented to occur slightly more in Black population than in other races. Our perspective today in discussing this topic is slightly different from what you've been seeing before. Today we will be talking with a real MVP, a dynamo, and a formidable warrior fighting cancer every day herself while being determined to make a statement with her life, educating people about the disease and helping them find succor whichever way she can. She was diagnosed 9 years ago with cancer in the brain and has been fighting non-stop since then. Today, we're looking through the eyes of a brain cancer patient to see and understand what life is like living with this cancer. And with me today to openly discuss this issue is the originator of Cancer Watch herself, the CEO of Comod Cancer Foundation, a philanthropist, a patient advocate, and one of the strongest people I know personally. Please welcome with me, Dr. Dennis Angel. You're welcome to Cancer Watch, Dr. Dennis.
Thank you, Dr. B. I'm really proud of you. Thank you.
It's so nice to have you here. I'm so delighted to have this conversation with you so that we can actually educate people together. And I meant everything I said about you being one of the strongest people I know. Let's talk about this disease, Walk us through what happened to you, what symptoms did you have, and how did you get this diagnosis, Dennis?
Welcome. Thank you, viewers. Thank you. Plus, thank you, everybody. It's quite humbling to be on this side. So let's go. What happened to me? I was diagnosed with... No, I wasn't diagnosed. So don't go like that. I had a headache. And I've learned about headaches now. But I had a headache that just wouldn't go. And I was living in Minna at the time. So you can imagine the sun is hot. I was a teacher, children are always making noise. So everything that is normal, the things that you count as normal, were what I thought was normal. You're expected to have a headache if you're working with children who make noise all day long. And I was running a group of schools. So I then started to take, I gone through a lot of treatment, like go here, complain about it. They say, okay, go and do this. First, we thought because of my ear that was hurting, was it to do with my ears? They checked my ears. That was in the general hospital in Minna. No. At a point, I got to the hospital in Abuja. I can't remember the name now. Nobody could tell me what was wrong. In Lagos, I had gone through quite a lot of issues to look at what was going on. No, there was nothing. And I just kept going from nobody could tell me why I had a headache. But I got to a point where the headache was so bad, it was choking, where you have a headache that you can't see anymore. And paracetamol doesn't work. Almost all the painkillers I could think of, none of them were working anymore. So I now had to start to work out that I knew honestly in my heart that something was terribly wrong. And the year before, when I first started, my mom was still alive. And I had said to her, but we couldn't work out. I had done all my checks as normal. So I knew that up to date, nobody had told me, and all my checks were checked. So I wasn't behind on any checks. And then I just found out that, okay, now it's time for me to start my journey that wasn't what was mine. I found out one doctor in Lagos just said, you know what, just come and have an MRI to your brain. And if we don't find anything, then I will be comfortable to say there's nothing wrong with you. Ha. I now went for this scan and found multiple. Don't know what they called it. They didn't call it tumors.
Wow.
They used that word in Nigeria. I don't know what you people call it. Mass.
Leisure.
Sorry?
Mass.
Yes.
Or leisure.
No, they used mass. So I was like, what's mass? But I couldn't lie. The problem was I couldn't even lie on the bed. Anyway, within 24 hours, I got the money I did for the treatment, and they did the scans and they found I had multiple in my brain. So they were trying to arrange for me to leave Nigeria, and I said, then there's no need. I will go home. I had a home in England, and I just luckily boarded the flight, not realizing the risk I had even put myself under because I had swellings. My brain was swollen. But I boarded the flight anyway and got home. Barely able to walk. I couldn't hold on to anybody. And I got home and my journey started there. And since then, we've been going. But like I said, it's headaches that started it.
Wow.
And from there, they found out because it was multiple. I now understand that multiple tumors in your brain is cancer. Single tumor in your brain may not be cancer. So I now know that. You see, you have to become educated as you go along. Then we started the journey. I had the first brain surgery within 2 weeks. They couldn't do anything because they had to reduce the swelling in the brain first, which meant I had to go on steroids. And once they got it down, then they were able to start the journey. I think you're a medical doctor, Dr. B. You can confirm what I'm saying because I'm only speaking from a layman's interpretation of my journey. And so that's where I
totally get it. Yes.
The journey we're still there.
Oh wow, Dennis, I can't even imagine. I mean, I'm sitting here listening to you. I've heard this story before, and it always just hits me hard every time I hear it because I mean, one day you're all fine and everything is going well. You've got goals, you've got ambition, you've got work going on, you've got plans and all of that. And suddenly, you're hit with a curveball. I can't even begin to imagine the emotional and spiritual and social effects on you. Tell us a little bit about what you've been through with treatments. What has your treatment been like?
Okay, now when you look at the word emotional, spiritual, and social effects, I would say to you that those are what really are the issues. So, from a cancer patient's perspective, the treatment of cancer, if you put the thing from 0 to 100, the sickness part of 0 to 100 and the treatment may be about 30% of the journey. The remaining that you just called are the remaining 70%. Because first thing, your world crashes. Oh. So my world crashed because at that time I had a child who was just in GS1. And I'm a single mother. So I didn't know how to go. Luckily, my other two children my youngest was on the other side, was about to graduate. So it was okay. And I thought, how am I going to navigate this? I boarded the flight and I said, do you want to come with me? My youngest one said, do you want to come with me to England? She said, no, I'm not coming with you. I said, okay, fine, you'll go to boarding house. And we sorted that out. And I left Nigeria, thinking I'll be back. I wasn't back till Christmas. And by the time I got back to Nigeria, I had brain surgery, cut, that's a craniotomy. And then I had gamma knife surgery, the one with the helmet, the one with the iron helmet that they've just shown.
Now they screw onto your head,
Yes, this one. Yeah, they screw it. So they screw it 4 places. 1, 2. This is metal, very heavy. 3, 4. I've had that 4 times, and I think the most painful part of that one is when they screw it in because the pain is excruciating. But once the medicine kicks in, then they start. The next part is that the surgery is about 5. The first one I did was about 5 hours, and that means you're lying on this ordinary scanning bed for 5 hours. My back, I was in tears by the time I came out. But that was
you were awake.
Yeah, awake. Yeah, awake.
Okay, you meant your gamma knife surgery. Okay.
The gamma knife one, I'm awake. The other one, the brain one that they call the craniotomy,
Okay.
is about 7 hours. The last one I did was 8.5 hours. But this one, the first one was 7 hours, and then the gamma knife was 5 hours. 5 hours. But that one I was awake for. That one was horrible. But then after that, one of the things that has given me strength, and I'll go to that most importantly, is my faith in God. And it was more because when I got diagnosed, I just lost my mom to cancer less than a year before. So I had gotten to a point where I didn't want to go through this journey and live for 6 months or 1 year. So I said to God, if I am going to live, then tell me what you want me to do with it. Otherwise, let me just go home quietly and my children will sort themselves out. It's a very hard statement to say, but I had to come to the point of knowing, because I knew my God before the illness. I was saying, not my will, but yours be done. And I will say to anybody, that's a prayer that if you don't have liver, it's a hard prayer to make, because if God's will is for you to go home, you have said, not my will be done. So I did. But then I also believe God, like I say. So I went back to the book of Ezekiel again, and which said that Ezekiel turned to the wall and God gave him 15 years. So I said, if you are going to keep me alive, then I want to be an Ezekiel. So you get it. So I had to put my God in the middle of everything all the way, because I couldn't have done it on my own. It was not possible. And we got through the first set. I got through, and I've been going through. My emotional health has been challenged, and is challenged again now as present. I'm not going to sit here and lie about it, because I've got another diagnosis that says I have to have another brain tumor in the next few weeks, another brain surgery in the next few weeks, and that is heartbreaking, because no matter how hard I try, I am still as human as everybody else, and you live in hope that you'll get a break. And I brain surgery last year, June, and so I thought I would have a break, and now we're going into June again, and I'm about to have another set of brain surgery again, this time with this stereostatic radio surgery for 5 days, and I'm going to be going home every day, and that is, no matter how anybody thinks, it's painful. I'm going to have the helmet refixed on my head
again.
Yeah, but that one, you fix the helmet, they prepared the helmet. So I think one of the pictures you had where I'm lying down, where you will find
and there's a device over your head holding you down.
Yes,
I remember.
That's the stereotype.
Well, then it's I really, I mean, I'm sure that our viewers are sitting in awe of who you are, because you make it. You say all these horrifying things, but you say them with a calmness that defy regular reasoning. And it's one of the reasons why I keep saying you're one of the strongest people I know. Your journey has definitely been something else, and I want to thank you ahead of for sharing with us, or just for being so formidable. I know you said your mom died of cancer. I'll follow that up, but we're going to just take a short break right now, and I'm urging all of our viewers to just stay with us. We'll be right back in just a minute. See you on the other side. Welcome back to Cancer Watch, and thank you for staying with us. Together we fight, and together we win. The conversation with Dennis on living with brain cancer continues. Thank you, Dennis. Earlier on, you mentioned that your mom had some sort of cancer and had died shortly before your own diagnosis. I wonder if there were any symptoms, if you could just briefly tell us any risk factors that you were aware of, that led to you developing cancer. Was there anything really spelled out as to why this happened?
Well, I've done a lot of investigation into this. My mom had lymphoma. My grandmother had lymphoma.
Lymphoma, you're right.
That's correct. Okay. And my so Hodgkin's and non-Hodgkin's. So one of my grandparents and my mom, both from the same lineage, had that the non-Hodgkin's type cancer. But I don't have that. So it's not, there's no link, there's no relationship. And then when I started this journey, many, many years ago, I had my lymph node removed because I was always having pus under the arm. And I had to ask them to go back and check what they found then, because they would have done a biopsy. And they said my oncology team had gone back to all my history to see if they could have ever found any link that may have helped them to stop me getting where I am. And as far as they're concerned, as of today, they said no. So I am a study even now. I'm a study. So
this is interesting. This is really interesting because you see, one big question that's really always coming up in the clinics is, why do you think this happened? Why do you think this happened? And I'm always talking to people about, well, there are risk factors, but sometimes we really can't pinpoint exactly why this is happening. And that maybe the bigger question will be, how do we move forward from this, you know? And I see that you did move forward, but I want to put you on the spot, okay? I'm going to put you on the spot right now and ask you directly, what would it have been like if you had been diagnosed and treated in Nigeria? Do you think the outcome, being alive 9 years after, still fighting, going forward, do you think it would have been the same if you didn't have the opportunity?
Now, this is a very heartbreaking question for me to answer, because I'll be dead. I would have died 9 years ago. There's no need for me to go all around in circles, because first and foremost, I am a teacher. So, and I'm proudly a teacher, which means that my income is limited. So you've got to recognize that whatever income I was having could never have paid for the treatment I am taking, and I have been taking for 9 years. So I would never have had the income to continue this journey. That's out. Then the surgeries I've had, some of my surgeries have been funded by grants because I am a case study. But those opportunities would not have happened if I was in Nigeria. Then my treatments have always been the latest ones that just come out as they come out. So for instance, now when I was told about 2 or 3 weeks ago that they don't know what to do because the tumors are growing, they were very clear that if they can't solve it, I would have to go either into trials or they would use whatever is available to manage me until, which made me have to ask myself, do I really want to continue? And I'm honest with myself. Like I said, it's very emotional because I know no matter what you say, I would never have been alive. And it's sad to have to accept that for somebody who sits on that chair with cancer.
Okay. Well, thank you so much for your very frank response. But let me follow up very quickly. How can we make things better here, baby? You've been at the forefront of advocacy. You put in so much energy. I've watched you speak at the international fora of different kinds. I've seen you in Nigeria weeping while you were talking about cancer patients, survivors, and all that they're going through. What are we getting wrong? What do we need to do better?
There's a Christian adage that goes, my people perish due to lack of knowledge. If I had known what I know today, I may not have gotten where I am. I'm not sure about my particular diagnosis, but as a cancer patient, what I know today, if I had known, I wish I knew that you could get cancer from headache. Let's just be as simple as that. I wish I had known I could have had cancer from a headache, because we're all human, and where, you know, like they say, you have a lump in your breast. You know, when you know you have a lump in your breast, please just check it. Take it. Don't let it get bigger, or don't wait. Don't assume. Because that, I think, is where we're getting it wrong. Advocacy and awareness. If people know what to do and how to get help, we will. I would like Nigeria to make sure that the basic testings that are required for everybody to survive, yearly checks, should, even if it can just be, find a way to make it non-paying, because at least that immediately helps you to not have to pay the bigger price of the cancer treatments. If that makes sense. Does that make sense? You know, so if, for instance,
it does.
Yeah, yeah, that's what I'm trying to get at. Because if you know that I go for my blood test and my blood test will show that there's an irregularity in the blood, as soon as that is seen, I'm not a medical doctor, I've learned it. If you can see an irregularity, it's best for the doctors to then quickly get that checked, which then means that if you have that HMO, is that HMO they call it? If everybody has that, it's more
Mhm.
likely that at least more people will be diagnosed of cancer at stage 1 and 2, which then gives us a survival rate for forever as possible, and if not, at least a longer period. Currently, I live on a time
Mhm.
bomb, and like I say to people that are close to me, I have to start, like, because of the last diagnosis, I had to start saying to myself, you know what if this is the end? What do you want to do, Denise? And I've got certain things that I need to go to make sure I finish, and then I'm ready to go. And that's the truth, because I'm tired.
Okay, there is. So we need better involvement. The government needs to just get better involved at the end of the day, you know. Symptoms are just being overlooked right, left, and center. And it really breaks my heart when you say, I didn't know I could, you know, get a cancer, that my headache could actually have been a symptom of cancer. So I didn't even know to be alarmed. I didn't know enough to be alarmed. Just like a woman will see a painless breast lump and think there's no need to be alarmed, you know? So it's, I think, more advocacy, more involvement, more buy-in, making certain screening programs free of charge, like you said, might be the way to go. But you said that I have limited time and I'm just pushing. I'm just pushing. What's your vision? What's the ultimate goal? What's your desire to achieve with your advocacy?
I used to be a teacher, so my dream now is that children, that cancer is in the curriculum. I write books now for children about cancer, but they're in story form, and then they have activities at the back, but they're in story form. Because if we demystify cancer as a killer disease, we are more likely to make an impact, because we're going to stop people from running away from treatment. Number one. Number two, if we educate children about cancer in secondary school, they are the ones that live in the communities. They are the ones that will recognize a mom or a grand or somebody with a lump in their breast and say, we need to take you to the hospital, because they've been taught about it. They are the ones, you know, one of the things I always say is that a child tells the parent what their teacher says. So they will go, my teacher said, and they don't stop.
Mm-hmm.
I think. So if the teachers are able to tell the children about this disease, it's more likely to be more effective. And you can imagine, if you start teaching about cancer in GS1, by the time you get to SS3, do you know the number of children who will be leaving secondary school with a lot of knowledge about cancer, as against what we have today? Number three, because, like I said, I'm writing my books. I want my books in libraries across Nigeria. I want my books in the curriculum. I want children to read it. I want it to be globally recognized. It's about Nigeria. It's about, my characters are all Nigeria, because that's all I know. But like, one of the ones I love the most now is the one I wrote on cervical cancer, which is to do with two ladies, one in Port Harcourt and one in Kano. And one is from a rich family, one is not from, but they come together somewhere along the line, and then they do advocacy together. Because I want to push advocacy, but through story, not through the hard things, but let children learn it and embrace it with some sense of responsibility, if that makes sense.
Mm-hmm.
So yeah,
It does, and I think you have a remarkable point there where you say children will say to their parents, "My teacher said this," and sometimes that can galvanize action. You know, people then take steps based on, from the mouth of babes, wisdom is coming out and all of that. Well done, Dennis. Thank you. We're almost out of time. I'm going to cram two questions together that I need you to answer in about a minute or two. What would you say to anyone who is going through brain cancer, or indeed any form of cancer, with all the anxiety and the worry and the strain that the illness has on them, and share with us, how do you Dennis, face each single day with so much poise and calm and positivity despite what you're going through, knowing that your brain cancer is incurable, having gone through everything that you have gone through. How does one get out of bed with cancer and say today is a good day nonetheless? 2 minutes, Dennis.
Oh, let me do the first one. How do I get through the day? I'm going to be very honest. I'm very good at crying it out. I come on air when I'm talking about my cancer journey to help other people. I have a smile, but when you push my back, then maybe you'll see me cry. But I do cry my day out, and that's standard. And I say any cancer patient, please do not cry, but not that you cry and then not do anything about it. You cry and then look for help. So don't cry and then sit down there and think it's going to come and meet you. It's not going to come and meet you. Help will not come and meet you. That's the first one. To everybody going through cancer, please, I am begging you, no matter what it is. I am 9 years on in August. I don't have a prognosis that says I should still be alive today, but I am. And I will continue with the encouragement that I get from a lot of people to fight. And I will say my last thing is the only reason that I think I might be able to go my next step today is because of the connections I now have in the medical world, because everything else has stopped encouraging me now. But I think the doctors that I've met along my cancer watch journey, right, are the ones that are going to be able to help me to see why I should continue treatment. And for that reason, I'm very, very grateful. So to the communities, please remember, we need you. We can't do it on our own. We are struggling mentally, emotionally, physically, financially. We don't even have money. We're the most expensive begging community in the world. So please, just give us dignity in our times like this.
Oh wow. Thank you so much, Dr. Dennis Ejo. You are amazing. And my viewers, today we've just had a very frank, emotional, but really truly educative session with Dr. Dennis Ejo. She has helped us to see how challenging the work of a person diagnosed with cancer, any cancer, and indeed cancer of the brain can be, and how they can keep living a rewarding life, no matter what, no matter where they find themselves, despite the limitations. Brain cancer is a big deal, and it's a silent killer, and it's usually silent at the beginning, and is associated with a lot of difficulties. The symptoms of this would include a persistent headache, abnormal gait, visual impairment, a lot of stuff going on, and so on. They indicate something sinister. So please ensure you go to a good accredited hospital and get yourself tested for any symptoms that may be. Let's keep this conversation going in our homes, schools, and community, because the more we talk, the more lives we will save. Thank you once again to our amazing guest, Dr. Dennis Ejo, and to you, our viewers, for joining us. Don't forget, your health is your responsibility. Until next time, please speak up, check yourself, and stay informed. Talk about it, share it, pass it on, and follow the Common Cancer Foundation and ARCON, the Association of Radiation and Clinical Oncologists of Nigeria, on all our social media platforms, and do join our growing community of warriors, survivors, caregivers, and advocates. Thank you again, Dennis. It was brilliant having you today.
Thank you. It was actually, it hit me today. I don't normally talk about it like this. You made me to see.
Yes. Thank you so much. Join us next week when we'll be talking about diet and cancer. It promises to be exciting. I will be answering a lot of questions. Goodbye, everybody, and thank you for watching. Bye-bye.